Good afternoon once again. The ATOS from Schwinn, the femtosecond laser with the difference. So I'll talk a little bit on the laser itself, a little bit on the centration, the energies, the outcomes, and what we are heading to later. The laser itself is a 4 megahertz laser, very high speed, low dose, high numerical aperture with excellent resolution. The laser cutting time is 20 seconds for a lenticule, the cutting time, and a 10 seconds extra on the dot, and for the flap is about 15 seconds. See, the automated centration, as you just saw, Dr. Pooja was showing you how it's very, very, very simple. There are two crosses, you align the two crosses on top of each other. It sounds very simple, but on a patient who is not very cooperative, it is not easy to align the two crosses on top of each other. So sometimes you do have what is called as a post-docking error. And as Dr. Pooja just showed you, the workflow is very simple, straight from the scanner into the ATOS. There's no in-between, like, other things that you have to keep working on. All you have to do is take a scan, put it in the ATOS, and that's it. It will do everything. All you have to do is you might want to change the energy levels, or you might want to change the refraction. That's it. So the other thing now, again, sometimes if it is very difficult to align, so what we have is Centrex, the new thing. So the green circle is about 200 microns. As long as you're green, Centrex takes care of everything. It can realign right on the dot. It compensates during and after docking. And once the vacuum is on, it can also compensate the cyclotorsion up to 10 degrees, and sometimes even more. Sometimes I think that more than 10 degrees, you should reposition your head so that the cyclotorsion is not too much. And because in high astigmatism, it can affect a little bit. It recognizes everything. So this is just, again, the same video which all you have to do is make it green. So last year there was Dr. Patrick. He was asking me, what if he cannot align on top of each other? So I had no answer. So the answer was, no, you try and align it again and again on top of each other. But this year we have Centrex. So as long as it's green, Centrex takes care of it. So again, one more time, cyclotorsion compensation can be done by the MS39, Cirrus, Paramis. Active docking guided by eye tracking. After vacuum is applied, there's active compensation of the remaining docking error by Centrex. Even in difficult patients, docking error is compensated. So this is stress-free for the patient as well as the surgeon. So the other concept, again, on the low dose, I'm so happy now Zeiss has also started doing the same thing there. I've been shouting on my voice, like, we should go low and have low doses. So, Dr. Sun, I'm so happy, and even Dr. Sri Ganesh, he showed something there. And it can also be done on VisuMax 500, actually. Can be done in any laser, I think, if you really plan it properly. So what we started off with, again, a symmetric pattern with high dose. The dose we have to understand. The formula of the dose is pulse energy divided by spot distance divided by track distance multiplied by 100. So we started off there, and then I have a very close friend of mine, Ivan Gebrich. He's very aggressive, and he's gone now and made a world record by operating at a low dose of about 300 millijoules per centimeter square. Like, this is amazingly, amazingly low dose. And again, the asymmetric type, you cannot just reduce the pulse energy. You have to plan on the asymmetry. So the spot 4.73 is okay with a 90 pulse energy. Then again, there's a difference that I'm trying to show you is a symmetric spot and an asymmetric spot. So the asymmetric pattern of treatment, you can really reduce the pulse energy. So what we did over here, when we started off about 5 years back, we started off like the VisuMax at 120, and then we had a symmetrical pattern of 4 and 4, and then over time now we've learned and we've gone down to 80, 6.5, 2.5, and the pulse energy is about almost 5, and this is where I operate most of the time. So this gives us very, very low swelling in the morning, and the results are amazing. The wow factor is like almost there like LASIK. So minimal strain to the eye, faster recovery, better resolution, and low corneal reactions. As Dr. Shetty always says, corneal reactions are so important. With high energy, sometimes in a few months, you start seeing, you activate the keratocytes, and you start seeing white stellate, like star-shaped opacities in the interface. Again, the lenticule. So there's a lot of things written over here. I'll explain it to you differently a little bit. The lenticule are always, it is thick in the center and thin in the periphery. So it goes right down to 0 microns. There's no minimal thickness there. It goes right up to 0 microns. The transition is about 0.8, which is huge. 0.8 is a large, large transition that we work on. It is progressive. It has an advantage. It works exactly like we're trying to work the ATOS like the MRS. We know MRS is one of the best excimer lasers in the world right now, and we are trying to make the lenticule also like the MRS, more and more customized. So you can, and there is no side cut because it goes down up to 0 microns. There is no side cut. It's an aspheric lenticule. It saves a lot of tissue, so sometimes it becomes very tricky in treating very, very low prescriptions, but you can always increase the optical zone and get a slightly thicker lenticule. I've made a lenticule up to 35 microns, but I have friends who have done up to 25. I wouldn't go below 30 microns. So what happens in the periphery is because it's very thin, large transition, 0 microns, the epithelial remodeling is very little. So the regression is very little after surgery. So if you look at this, we did a small study, not a small study, this has been published, and on 2,000 consecutive eyes, where we've taken out all the patients from the COVID period, 2 years. That is because the laser is not serviced. We're using the same treatment pack, so we said, okay, we take the COVID period out. If you look at this over here, so 44% of our patients were 2016 in 12 months. If you look at that, and 88% I would say, and if you look at the efficacy index over here, uncorrected visual acuity within one line, 98%, this is in 12 months. If you look at the scatter diagram, the R value is about 0.96, and if you look at the stability, from 3 weeks, they're absolutely stable. And even with the cylindrical correction, the R value is about 0.7, 0.97, and most of the treatments are within 1 diopters. If you look at day 1 results, 35% of patients at 2016, day 1 with low energy, asymmetric pattern. And even the cylindrical outcomes over here, in day 1, most of the patients within 1 diopter. And when you're talking about high astigmatism, like more than 2.5 diopters of astigmatism, I think I've treated about 6 or 7 patients with more than about 6 diopters of cylinder. So if you look at the R value is about 0.97, amazing results. What I'm trying to tell you, the cylindrical correction is amazing because the centration is good, the cyclotorsion is good, the energies are low. And again, there's certain things that we can actually, this has been published now, we can manipulate in most of the lasers is things that really affect our asymmetry. Larger asymmetry is good. Track distance, smaller the better, easy to dissect. Laser energy and power, the lower the better. Spot distance, larger the better. Date of surgery means an experienced surgeon will definitely have better surgery. Cap thickness, and I think dose is most important. Lower dose gives you better results. The other things that have come up now is pure cylindrical treatments. You don't have to put a minus 0.5 or 0.25 or something. Your pure astigmatic treatments have been started in few centers with amazing results. And the warming procedure of the ATOS is sometimes, some surgeons are very, very upset with a long warm-up time. When we started off, it was about 15 minutes, then it went to 60 minutes, 78 minutes, now it's come down to 40 minutes again. We're all trying to be more and more safe, actually. For us, I think the Schwinn company is looking into like really safety of the patient's accuracy and how the surgeon as well as the patients are very, very happy without trying to move into so many weird things that we always talk about. So the other thing that's available is tunnels with 2 incisions. And I thank Dr. Shetty for letting me give a talk over here. I'm so happy. I'm so happy to meet all my old friends that I met last year, and I've been meeting them for the past 15 years. Thank you so much. And I always like to keep this photograph. Makes me feel young. Thank you so much.